Hello. My group's talking about universal healthcare. Imagine every neighborhood, every coworker, and family members that you know getting timely healthcare without worrying about medical bills. Picture a community where sick children are able to get healthcare same day without having to worry about it, and parents receiving mental health support without facing bankruptcy. And businesses do not have to lose their employees due to untreated chronic illnesses occurred on the job. The future is possible if you urge our government to make universal healthcare a reality and fund it through fairly mix of progress taxes, employer contributions, and sensible insurance rules. Universal healthcare is not a luxury; it's a civic necessity right now. Millions of people are facing crippling out-of-pocket costs, delayed care, and preventable health issues that if they saw a doctor earlier, they would be alive right now. The question is whether we can afford universal healthcare, is whether or not we afford not to have it. The financial choices we make will decide the coverage of sustainable, fair, and political viability.
The U.S. coverage gap remains large among working-age adults 18 through 64. Are estimated 11.6% were uninsured in 2024, leaving many without regular access to healthcare. High costs put care out of reach for many families. Recent pollings find that healthcare costs and unexpected medical bills are a top financial worry, and the lead nearly half of adults to report difficulty affording care or prescriptions in 2023. Roughly 26 million Americans, about 8% of the population, lacked healthcare insurance, and many more are uninsured and avoiding care because of the cost. Meanwhile, U.S. healthcare spending totaled around 4.6 trillion in 2023 and roughly 16.7% of GDP. Meanwhile, financial choices significantly affected whole economies and household budgets.
We are not starting from scratch. Our tax system, payroll setup, programs like Medicare and Medicaid give us a base on how to expand our health coverage. Community health centers and public hospitals already help people without insurance and can do more with steady funding. Employers and payroll systems will make it practical to collect contributions and track payments. Other countries' experiences offer useful ideas on how we can adapt to universal healthcare. My plan starts with expanding and stabilizing public coverage and subsidies to reduce unpaid medical bills and bill support. Then we raise money mostly from higher incomes, add a small subcharge on the very wealthy, and close tax loopholes so those who could pay more do so. We would also require medium and large employers to contribute to a subset share on a pool health fund or an offer of qualified coverage. Finally, combining funds into a large risk pool and improving how we buy and pay for care will help control costs, keep quality, and cut waste spending.
Here's what I need you to do. Contact your local representative and ask for a phased universal healthcare financing plan that includes progressive revenue, employer contributions, and a unified risk pool. Secondly, share one page of clear notes with friends, family, co-workers, and community groups, informing them about the mechanisms that could protect families and strengthen our economy. And lastly, I urge you to vote for candidates who support evidence-based and financially responsible healthcare reforms. Universal healthcare is a realistic goal that makes our communities happier, healthier, and more resilient. Funding it fairly means asking those who can afford it to contribute more, asking employers to participate responsibly, and making a system that works to make everything better for everyone. If we act together and insist on a clear, staged plan, we can transform the promise of healthcare from a promise to reality.